Hi, my name is Dr. Shane Methal here at Green Street Dental in Soho, New York. I graduated from Cornell University back in 1996, the University of Maryland Dental School in 1994, where I received my DDS degree. I did a one-year residency in advanced general dentistry, and have been in private practice both in Maryland and consequently back in New York for the last 17 years. I've been an assistant clinical professor at NYU College of Dentistry for over 10 years. I won a Distinguished Faculty Award in 2004, which I'm very proud of. My office website is www.greenstreetdental.com. That's green with an E at the end. And today I'm going to be talking about teeth and dentistry. There are many options available to you if you do have one or several missing teeth. The most simple solution is to use a removable denture, also called a partial denture. This can be made out of plastic and or have a metal base. These are removable at night, very functional, and sort of aesthetic. The next approach to filling in a space is to use something called a bridge. This is where we use the teeth on either side of the space to then permanently cement something to fill in that space. The downside to this is it does require modification of those adjacent teeth. The next level of filling in these missing teeth is now the gold standard in dentistry, and this is where we use dental implants to fill in the missing teeth. This generally does not require modification of the teeth on either side, however, may require modification of the bone that the implant is going to be placed into. Dental implants do take longer because there is some healing time involved, but generally the payoff is worth it in the end. Affordable teeth whitening procedures. They can include something as simple as an over-the-counter rinse, gel, or even a pen, to something that involves a tray that fits on your teeth that you put bleaching gel into. The over-the-counter options tend to have a lower concentration than what a dentist would prescribe, but tend to be a safe, economical, and viable option for those seeking a slight improvement in their smile. Keep in mind, over-the-counter products tend to remove external stain better than internal stain and will not affect any existing dental work. Other alternatives include something that a dentist would prescribe, also using a much more accurately custom-fitted tray with a bleaching gel, and sometimes even using a light-activated or laser bleaching system. There are many options available to us depending on the nature of the problem. Problems could include worn, cracked, or broken teeth, crowded teeth, aesthetic problems, shade, shape, and so on. Missing teeth is even something we need to discuss. There are several options available to us. Could range from something as simple as reshaping chipped or worn teeth, tooth-colored fillings, metal fillings sometimes will appropriate, or actual replacement of missing teeth with a partial denture or bridge or dental implant. It really depends on the problem. All options can be considered affordable. Sometimes when we are younger and sometimes when we are older, our teeth can be crowded, misaligned, or shifting. If this is the case, this can cause other problems with your bite. If that's true, it's important to straighten your teeth out to maintain better overall hygiene and or improve your aesthetics or your smile. As we get older, it is not uncommon for our teeth to crowd or recrowd even if you've had orthodontics or braces earlier. As adults, several options are at your disposal. Clear tray braces can now be used, which are removable appliances, something you wear in and out that can help move your teeth in as little as 6 to 9 months. More traditional braces or orthodontics require bonding a bracket to each and every tooth that needs to be moved or a band and attaching a wire. Over the course of months to potentially years, this wire will continue to straighten your teeth and move them into the correct position. Ideally, the straighter your teeth are, the healthier you can maintain them. Well, the short answer is yes, if you over-bleach. By that I mean sooner than every 6 months to a year. If you do over-bleach, you can cause permanent changes into the outer layers of the enamel of your teeth, which could result in permanent sensitivity and or color changes which are undesirable. When you over-bleach, your teeth do not get whiter and whiter, but instead can become blue or blue-gray as you bleach out all the pigment. So make sure you don't over-bleach any sooner than 6 months to a year at most. There have been a plethora of new technologies which have greatly aided my ability to be the best dentist I can be. Number one being digital radiography. We now use digital images instead of traditional x-rays, which requires much less exposure to the patient. These images are much more diagnostic and can be manipulated to a much greater degree of accuracy. A new technique called laser fluorescence can also be used to diagnose cavities much more accurately than we've ever been able to before. This involves using a laser to scan the biting surface of the teeth for changes in density of the enamel. Laser fluorescence is a much more accurate technique than using a sharpened instrument and much more comfortable to the patient. Dental implants have become very commonplace and in some cases the standard of care. Instead of having a free-floating denture on gum tissue, we can now use dental implants to anchor a denture in place or replace missing teeth. Computers have greatly improved the materials with which we now use in dentistry. Computer-aided design machines can mill crowns, bridges, and dentures with a much greater degree of accuracy and ease of fit than we've ever thought possible. If you are unhappy with your smile, there are several things you can do to correct it depending on the nature of the problem. If your teeth are slightly misaligned, crooked, or worn, bonding or composite laminates may be an approach. However, some people have problems with their gum tissue. Some people, when they smile, show too much gum tissue or their teeth appear too short. If that's the case, you may be a good candidate for a procedure called gingivectomy or aesthetic recontouring of the gum tissue. This has traditionally been done with a scalpel or an electrosurge unit in the past. Nowadays, lasers are much more tissue-friendly and patient-friendly. If you're unhappy with the appearance of your teeth otherwise, porcelain laminates or veneers may be another approach. In some extreme cases, skeletal surgery is necessary to correct major misalignments of your smile. Talk to your dentist to see what's appropriate for you. By age 2, we should have approximately 20 primary teeth. As we get older, these teeth shed, and an adult human should have 32 teeth. Most people, however, have their wisdom teeth extracted and as a result end up with 28 teeth. Sometimes teeth are also removed for orthodontic purposes or for braces. If you have too many teeth, this can cause problems with aesthetics or crowding. If you have too few teeth, the spacing can cause teeth to drift or tilt, and that can also cause problems with your bite. In that case, you have to talk to your dentist about filling those spaces with implants, partial dentures, or bridges. Most schools require a minimum of 2 years of pre-doctoral classes. This includes organic chemistry, inorganic chemistry, biology, and physics, although most applicants have at least a 4-year college degree. In addition, all schools in the United States require the Dental Admissions Test, or DAT, to gain acceptance. Upon completing 4 years of dental school, you will either receive a DDS or DMD degree. New York State in particular, and many other states, may require a residency which could last 1 to 2 years as postdoctoral training. If you want to specialize, that may require an additional 2 to 3 years of training. In the case of oral surgery, it may require upwards of 7 years in additional training. So in total, it could be a combination of 4 years plus either 2 or 4 prior years plus an additional year. You can use either a manual or electric toothbrush, but your technique is important, especially with a manual toothbrush. Make sure you use soft bristles. You do not want to use medium or hard bristles because, especially coupled with an improper technique, you can do damage to your delicate gum tissues. Make sure you angle the bristles at a 45-degree angle towards the gum line, both on the bottom and the top, and use sulcular or little circular motions. Do not scrub back and forth, as this can cause damage to your delicate gum tissues and cause them to recede away. Ideally, you should brush for at least 2 minutes. That encompasses 30 seconds, 30 seconds, 30 seconds, and 30 seconds. If you do use an electric toothbrush, make sure you follow the manufacturer's recommendations. Generally, technique isn't as important, but you must hold the toothbrush at a 45-degree angle and work it around for 30 seconds in each quadrant. Again, soft bristles is the key. Well, first of all, relax. We are here to help. Second, focus on the advances modern dentistry has partaken in. We now have digital radiography, which requires less radiation. New tools, including laser cavity detection, don't require the use of a sharp instrument. We play music, we set a relaxing atmosphere, and most of all, it's important to have trust in your dentist. We are here to help, so there's really no reason to be scared. Although, if you still are anxious, Talk to your dentist about some options available to you, like a prescription for anti-anxiety medication or the use of laughing gas or nitrous oxide to relax you. Bottom line, there's nothing to be scared of. And remember to breathe. The looser you are, the more relaxed you are, the more pleasant experience this can be. Well, it's important to rule out any deeper or more severe problems which would cause your teeth to be sensitive. For that, you need to see your dentist. The problem could be as a result of gum problems or cavities or cracks in your teeth. Some people, however, just happen to have sensitive teeth. The most likely complaint is sensitivity around the gum line, where the gums may have receded due to previous gum problems or overzealous brushing. For this, you can try an over-the-counter fluoride toothpaste or an even more specialized sensitivity toothpaste. If this does not work, then you can see your dentist and they can talk about some options in the chair, like applying a desensitizing agent to the specific tooth that may eliminate the cause. In addition, there are prescription fluorides, which are much stronger than the fluoride you use in your at-home toothpaste, or a newer class of drugs called calcium pastes, which not only have prescription fluoride, which also have calcium and phosphate, which have been shown to strengthen and desensitize teeth. Once again, it's important to identify the cause. This can be a complex answer to a complex problem. It depends on how the teeth are broken. Certainly, if an emergency has just occurred, it's important to talk to your dentist right away and see what can be done. Broken teeth can include something as simple as small chips or fractures in the edges or biting surfaces of the teeth, all the way to teeth that have complete cracks through and through. The simple solutions entail either smoothing the sharp edges or using tooth-colored bonding materials to reshape the teeth. Sometimes metal fillings are required. Depending on the nature of the break, something more full coverage, something called an onlay or a crown that fits over the whole tooth, may be necessary. If you are in extreme pain, it is possible that the nerve of the tooth may be involved. If this is the case, before any filling can be done, a root canal procedure may be necessary to save the tooth. Once that's completed, the tooth could be rebuilt with some type of filling and have a crown or a cap placed over top of it to hold it together and be aesthetic. Again, it really depends on where and how it's broken.